Hi guys, I'm Michelle. I'm a licensed massage therapist in Washington State, and I bring you MBLEx resources both here on YouTube, tons of free videos, but also on my website, in the link in the description below and also in the pinned comment, you're going to find a huge list of tons of resources. I've got study guides, practice tests, I've got full courses if you need to go really in depth, if you've been out of the loop of studying anything massage therapy related for a long time, but you want to pass that MBLEx, there's tons of stuff in there for helping to get you back up to level for taking the exam. Today, we're going to be talking about the new ebook that I just finished up based on ethics. So far I have an ebook on client assessment. I have an ebook on guidelines for professional practice, but I want to just keep that up by creating ebooks for each of these significant non-technical topics that the MBLEx is testing on. And yeah, ethics is the newest one that I just created, and I'm just going to go over the main topics just so that you understand these concepts. And if you want to go ahead and get a hold of that ebook, it's going to be in the link in the description below, and you can get it for free and just download it. In the ebook, I go over these topics more in depth, and I write fully, but it's really easy to read. And then at the end of each mini chapter, there's going to be a short list of MBLEx practice questions to help you to get in the mindset of what kinds of questions they're going to be asking you on the exam and how to sort through the nuances of tackling ethics. So as I'm going over all of this, all of these topics, I will have timestamps for each of the chapters that I'm going to be doing, so you can go straight to the ones that you feel like you need more work on. But when it comes to certain situations, and so that's what the MBLEx is looking for. It's like, do you have these basic principles dialed in, and are you willing to be flexible with your clients if their care is going to be impeded by your personal boundaries? So that's what they're looking for in that. And so keep that in mind. And when you're looking at any ethics related question on the MBLEx, remember to choose the best answer out of the options that they have, not necessarily what you think would be the best answer. You have 4 choices on a multiple choice question. You have to pick the best one out of their list of the options that you have. That may not be what you would do. Okay, so remember that when you're taking your MBLEx. So you could argue all kinds of stuff, but all they're looking for is that you've chosen the best answer based on what the panel of the Federation of State Massage Therapy Boards has decided is the most ethical decision in that kind of situation. Okay, so first chapter that we're going to be going over is ethical behavior. So massage therapists are part of the healthcare community, and they're expected to uphold the same professionalism as any other provider. Ethical behavior creates trust, safety, and respect for clients and other colleagues. So first of all, we don't discriminate based on race, gender, age, body type, sexual orientation, religion, or someone's ability. We do our best to try to serve our clients. Next, we respect our clients' beliefs, and we respect their boundaries and comfort. So we honor their perspective, their modesty, their communication style. We try to find a way to work with them and help them to feel as empowered as possible so that they can trust us when they're in our care. And sobriety. This is a huge thing. Always be 100% sober when you're working with your clients. If you went out and had a good time the night before, you might need to call out if you're still feeling pretty bad the next morning. What I do, my rule of thumb is, if I know that I'm going to be working the next day, I don't go out and play, because I want to be at my very best when I'm working with my clients. And this also goes for prescription medications as well that might impede our sobriety, our mindfulness, our ability to be completely present in the room and able to give our best to our clients when they're with us. Okay, so the next chapter is professional boundaries. I'll drink my coffee. So boundaries define the line between professional and personal relationships, ensuring both the therapist and the client are protected. So we want to maintain therapeutic and not personal connections. That means that when we have our clients and we have them repeatedly, right? We start to get pretty comfortable with them, but we need to always maintain that professional boundary. I have clients that might ask me some personal questions, and I try to answer them with kindness. I provide a little bit of information about myself, just because I'm not a jerk. Right? So you will in time develop the skills to be able to be personable while also being professional. So we're not going to be sharing a ton of, especially like complaining information. And we might be like, oh yeah, I had a really good time on that vacation and I'm pretty happy. And then we move on to talk about the therapy that we're going to be having. So, this is a huge part of respecting our clients' time, is that they're paying for the work that is being done. And a lot of the time they just want to completely get into it and enjoy the massage. So we're disrespecting their time if we're going on talking about ourselves. If we're going to be going on talking about ourselves when we're having the exchange at the beginning of the intake, at the beginning of the session, where they're sitting in the seat and we're sitting across from them and we're just talking about ourselves and what we did the weekend before, or like who's bothering us right now, we're stealing their time. So we have that professional boundary of, we're going to get this done. We're going to get the client in, take care of their needs, and let them go about their day, right? And so we're going to avoid discussing those private issues when they're just not related to the treatment, and you're not going to be rude if you're, it's not anything that, just share the minimal. That's what I'm saying. Share the minimal, and it's not rude to keep some things to yourself. So moving on to the next chapter is dual relationships, and that is when a therapist has another personal, financial, or social connection with a client. So that's like, I'm doing house cleaning. Like I used to do house cleaning before I was a massage therapist. I had my own house cleaning business. So I'm doing house cleaning, and my house cleaning client heard that I'm now a massage therapist, and they're like, I want a massage from you. That has become a dual relationship. Now, a dual relationship is not a terrible thing, but it is something that we have to navigate carefully because it can end up becoming risky. This is also the case if you've got a friend that wants a massage from you, or if you start becoming friends with your client, or your massage client wants to hire you to dog sit for them or something like that. That becomes a dual relationship. So when you are entering into a dual relationship, you want to be very careful about your boundaries, be tactful, and be upfront about what those boundaries are. You say, okay, well, you're my friend and you want massages, and you don't really want massages from anybody else. It would be best if I was to refer you to a friend of mine that I know is a really good massage therapist, or a peer of mine that I know is a good massage therapist. But if I am going to, I'm wearing my massage therapist hat when I'm in here, and I keep it professional, and I do the job the way it's supposed to be done. I'm not goofing around and like turning it into a party on the massage table. And then if somebody, it's best if you get a massage, an MBLEx question that's asking if a client is inviting you to a barbecue, on everybody's personal time. This 4th of July barbecue happening. The best choice in those questions is to go into saying that you have to retain a professional relationship and just don't go. So if they're inviting you to a fundraiser of some kind and it's with your professional hat on, that's a different story. These are the subtleties that I'm talking about with these ethics questions. So watch out for that. So an existing person becomes a client, clearly outline those professional limits, and then seek guidance from a supervisor, a mentor, or an ethics board if you are not sure how to proceed. That's how you would answer a question like that. if that was the best choice on your MBLEx questions. So next, a big topic that's hugely important is sexual misconduct. And that's when we're talking about dual relationships. If you start becoming attracted to your client and there's a temptation that you want to date them, and it's mutual, even if it's mutual, right? Even if it's consensual, in most states, it's a crime for a massage therapist or for any healthcare worker to become romantically and sexually involved with their client because of the therapeutic. And this is important because of the power differential that happens between somebody that is in the healthcare position and someone who is in the client. We're going to go further into that in just a short bit. But if you do become attracted, you build this awesome bond with one of your clients, which, if you had good professional boundaries, that's unlikely to happen. But if that does happen, they had better be worth losing your license over. If you want to move on, if you're like, I don't care about massage anymore, I want to be with this person more, then okay, go do that. But you don't get to be a massage therapist anymore, because when you are found out, it's really likely that you might have criminal charges pressed against you, depending on who it is that's investigating you. So keep that in mind. If there's any question on the massage and bodywork licensing exam regarding dating a client, it's always, we don't do it. Always, always, always. Okay, so maintain appropriate boundaries. Physical. Every time you touch your client, it has to be with the intent of a therapeutic outcome. Okay? Nothing else. Emotional. Keep a professional distance. Don't ask personal questions of your client, and try to steer the conversation in a different way if your client is trying to do that with you, to develop that emotional connection that can happen in romantic connections. And then any seductive or predatory behavior is illegal. We should just know this, right? So recognize and respond professionally to sexual innuendos or advances from clients. So you might get a question where a client is, making suggestive gestures toward you while you're working with them, and your response should be to clearly state your professional boundaries. And and then maintain appropriate attire, professional advertising, and a neutral therapeutic environment. So I'm not being a female and disapproving of what they call shaming. I don't like the idea that we should be more careful, that massage therapists should be more careful about what we wear so that we're not attracting the wrong sort of client. But the truth is, this is just facts aside from the MBLEx, that the wrong kind of client is going to find their way into your massage room. And that's just a fact, no matter how modestly you dress. It's been my experience, it's been the experience of most of the massage therapists, male and female, that I've talked to. So don't worry about that too much in your actual practice. But when you're taking the exam, it's something that you need to know, is that they're saying, don't dress too sexy, because people might get the wrong idea about you. And it's the same thing with your advertising. You're like, massage therapy or something like that. I mean, okay. Anyway, so yeah. And then make sure that everything in your environment suggests that you are a professional and you're not just a rubby kind of massage therapist. As you can see, I have these posters on my wall that say that I am a person that has been trained in a healthcare field. Okay? let's see. And then understand that any sexual act with a client, even if consensual, can lead to a loss of licensure and possible criminal charges, as I said before. All right. So the next chapter, Code of Ethics and Violations. The Code of Ethics provides the framework for professional conduct in massage therapy. Okay, so here's a list of the ethics that we need to keep in mind. Confidentiality, integrity, referrals, law and policy, and then violation consequences. Let's go in deeper about those. Confidentiality, we have to protect our clients' personal information at all times. Okay, so that is, I'm going to go deeper into confidentiality, but that means making sure and locking all of their personal informations in a file cabinet that has a lock on it, or making sure that you have the appropriate firewalls if everything that you're storing is digital. We're not going to share any kind of personal information with anyone that isn't our client. And then if we're going to be sharing information with another healthcare worker, we need to get written permission from the client in order to, yeah. Okay, so integrity, be honest about our skills, our credentials, and our scope of practice. We're gonna go more into that in a little bit, but yeah, we're not gonna be talking about how we have special training in a modality that we don't have it in. Like, we're not gonna pretend that we know more than we actually do. So like I have clients that have edema and they're like, I want you to work on my legs. And I have to say, yeah, I'm not trained in manual lymphatic drainage. So I'm not actually going to touch your legs, instead of pretending that I do know how to do MLD. And then referrals. Know when to refer a client to another healthcare professional. You will have questions on the MBLEx about situations when to refer, and specifically regarding pathologies to watch out for referral. Make sure and check out my Pathologies for Body Workers course that you can find in that list of resources in the pinned comment and in the description below. And then law and policy. Understand your local board's ethical and legal requirements. So like say regarding how long you have to wait before you can date one of your clients. Each state has a different rule. So some of them are like, you need to not be treating your client for 2 years before you can date them. And that's the case in Washington State. Different states have different rules. And then also regarding how you hang your shingle, some local municipalities will require that you have to have a business license at the city, county, and state level, and then others have different rules. So make sure that you know all of that. That's part of your code of ethics. And that also has to do with making sure and maintaining paying your taxes if you're self-employed. That's an ethical standard that you have to maintain. And then violation consequences. So understanding that breaches of confidentiality, scope, or boundaries can lead to license suspension and revocation. And something else that I want to mention under these code of ethics and violations is I think it's going to come up in another topic too, but understanding jurisprudence, which is knowing your local laws. So now we're going to go into understanding more about the therapeutic relationship. That is the relationship between you and your client and how that plays out. So it's built on mutual trust and respect. You need those in order for the therapy to happen efficiently and successfully. Key concepts: transference and countertransference, and the power differential. So transference is where a client projects their feelings and their perceptions onto the therapist. So a transference would be, you remind me so much of my mother, right? The way that you take care of me. That would be transference. Countertransference is when the therapist puts their personal feelings on the client and it influences their objectivity when it comes to their client's treatment. One thing, for example, is like, oh, those guys are always like that, making sexual gestures at me. So that would be countertransference. So, and then the power differential is understanding that your client is in a vulnerable position because they're typically undressed, laying down on a table, and you're standing over them working on them. But also because you have knowledge that they may not, regarding how to take care of their bodies. So these are really important concepts to dial in so that you're able to maintain an objective view of how this relationship is going around, and you're with that mindfulness of that power differential and the transference. You're trying to encourage your client to advocate for themselves as much as possible in their treatment. That ends up being better for them in the long run if they're able to advocate and if they're able to fully understand what's going on. So obtain informed consent before all treatments. I'm talking about before they even lay down. So when you're going to go start, they come in for their intake, even if you've been seeing them for years. Talk about what you would like to be doing, what they want, and get their consent before they undress and lay down on the table, instead of waiting for them to be face down, prone, in the face cradle, being like, I'm going to do all of these things. And they're like, oh, okay. Because they're not in a position to argue with you about it, right? So encourage the client's autonomy. Help them to make their own decisions, even if you don't necessarily agree with them. Now, you may have your professional boundaries about what you will and will not do, and that especially has to do with our scope, but they get to decide ultimately what's going to happen. So encourage them to make those decisions. Protect their modesty, their comfort, and their emotional well-being. Make sure they feel safe, physically and emotional. Massage, remember that massage doesn't diagnose, prescribe, or cure. It supports the body's healing processes. So that is a part of the therapeutic relationship, is to being clear about what you can and can't do. Now, regarding professional communication, it strengthens your credibility and your collaboration. So that's why we're practicing communicating as healthcare workers. So it's important to accurately represent your credentials and training in all of your marketing and all of your conversations. And I've spoken about this already. We don't say that we can do things when we can't, right? And then use clear, compassionate language with clients to empower their participation in the healing, and communicate respectfully with all other healthcare professionals, even when your opinions differ. So you've got a physician that's sending a referral over. They say they want these specific structures to be worked on the body, and you're like, oh, but they also need these things, or I don't agree with how that physician prescribed pain medications to that client. Like, I don't agree with all that stuff. It's not your place to judge them on that. You have to be respectful to them. Even if you don't agree, you got to keep it to yourself. If you feel that it's a good idea to make suggestions within your scope. So I would, instead of saying, I don't think you should be taking those pain medications, instead I'm going to say, how about I suggest some stretches for you? Which might help, you never know. So in that, I'm not promising anything. I'm not prescribing anything, because we don't do that. But I'm just like, these stretches might help, so why don't you give them a try? So that would be okay. But not exercises, because we're not physical therapists. Remember that on the MBLEx. So the next, wait, did I miss one? Okay, represent massage therapy as complementary component of wellness and not a replacement for medical care. Okay. So finally, scope of practice. Massage and bodywork practitioners must stay within their defined professional limits. So we don't diagnose, we don't prescribe. It's complementary therapy, not a cure. We have to explain our clinical reasoning without overstepping into saying that it's going to be curing anything. And always work within our clients' physical limits. Recognize when to refer out for your needs beyond your scope. Pathology's course. Mental health, physical therapy, or medical issues. So refer for those things. It would be really great if you were able to swing adding some physical therapy in addition to massage therapy. That would probably help you a lot. Why don't you give it a try? Or why don't you maybe you should talk to your physician about a referral to physical therapy. That's a good one. That's a juicy one. And then finally, I wanted to mention, as part of scope of practice, at least in Washington State, it might differ in different states. Make sure and check out your jurisprudence for your particular state or your particular municipality. But massage therapy generally is about the manipulation of soft tissue and not the bones. So we don't do any kind of thrusting movement in our treatment to crack joints. Sometimes when I'm doing some deep tissue on somebody, a joint will pop, or if I'm massaging their hands, their hands will crack a little bit. As long as your client feels safe and comfortable, that can be okay, but we're not doing it intentionally. All right, so we don't do that, only soft tissue manipulation. Okay, confidentiality protects the therapeutic relationship. So we have to uphold HIPAA standards. That's the Health Insurance Portability and Accountability Act. Whether you're dealing with health insurance or not, HIPAA still applies conceptually to protecting your client's records. So never share client information with other clients, friends, or online without written permission. That includes marketing. Keep your discussions professional. Avoid identifying details in public or on social media. When coordinating care with other providers, only share necessary information with written consent. Okay, so in social media, even innocent posts or marketing examples can unintentionally breach confidentiality. Never share client photos, testimonials, or case details without explicit written consent. Avoid identifying details such as tattoos, body markings, or personal stories that could reveal a client's identity. So when posting about your practice, focus on your techniques, philosophy, and environment, not individual clients. Maintain professional language and avoid responding publicly to client reviews or comments that discuss private session details. So just make sure that you keep their autonomy and their privacy safe in your presence. So let's see, principles and ethical decision making. So ethics is an evolving practice guided by reflection and integrity. So when you're making decisions, you have to, as a healthcare provider, you have to weigh out what's going to protect your boundaries, what's going to protect your client's personal boundaries, and what's going to get them the best care. So you have to approach it by what your client's rights are, what's going to be just for them, what's going to be best for the good of everyone involved, and you have to keep in mind your morals and your integrity. Ethical practitioners are consistent yet adaptable when faced with dilemmas. So consistent, these are always my standards, but there are times when I will tweak things a little bit to help you out. One example of that would be a very mild example for myself would be I always take Wednesdays and Thursdays off because those are the days that I'm able to be with my partner. But if there's a client that's been asking me for treatment for weeks, but they're not able to come in on a Wednesday or Thursday, I'm like, okay, I will come in on this day. It's my choice. I will come in on this day, just this one time, to help you out. But I would like to try to find a way to get into your schedule on my regular working hours. But they needed it. They really needed it. So one time I will do that. So be adaptable sometimes if that's what's necessary to help your clients out. So seek peer discussion or supervision when uncertain. And remember that collaboration promotes growth. You can learn a lot from your peers. So regularly reflect on your decisions and continue learning about ethics as the profession evolves. Continue working on it. That's why we have ethics courses that are mandatory in most states as part of your continuing education every reporting period. And then finally, remember to take care of your own body, be accountable to yourself, taking your days off, taking your time off, not overbooking yourself so you get worn out. So avoid contagions. If you're sick, you have to reschedule. We're not going to be spreading germs. If a client reaches out to you and says, I've had these symptoms, but I still want to come in for a massage, the ethical thing to do would be like, I'm not going to spread disease. I'm not going to get sick, and I'm not going to put my other clients vulnerable to getting sick. So even if I want that money, even if they really, really need the massage, that's a boundary that I have to stick firm to. No sick people in my treatment room, and it's not safe. If you go check out that pathologist video, any kind of inflammation in the body, that they have a fever, if they're sick, we just don't do it. We don't massage them. So yeah, prevent burnout by making sure you get support from your peers. If you already have a full client roster, refer those new clients to your peers that would like to have more clients. Share the wealth, right? And also you're not overburdening yourself and burning out. And then so be open to feedback, accountability, be open to feedback, report unethical behavior. You're probably going to get a question about that in the MBLEx about this is the scenario, what should you do, how should you report it? There'll probably be a question about that. Stay current on your education. Make sure and do those continuing educations. Credits often in our state licensure, it's an honor system, but there's a reason that it's required, and that is for you to stay up to date on the latest trends, especially when it comes to ethics. So part of that accountability is modeling professionalism in person and online. So on your social media, make sure when you've got your massage therapist hat on social media that you're representing the profession of massage therapy professionally. Okay, and then I'm just gonna go over these reflection questions real quick that are in the ebook. What does professional integrity mean to you? How can you protect both your client and yourself through clear boundaries? What would you do if a client asked for treatment that feels outside of your comfort zone? How might you respond to an ethical dilemma involving confidentiality or consent? And how can you maintain enthusiasm and self-care while upholding your ethical responsibilities? So these are all questions for you to consider when it comes to ethics. When you have that figured out, when you have your boundaries figured out when it comes to ethics, that's going to help you to be able to answer the questions, find the best possible answers on the MBLEx. So what I'm going to do is I'm going to flip the camera around and I'm going to just go over a handful of MBLEx style questions so you know what to expect. I'm going to see you over there, and I just want to make sure and get it out there to subscribe and like the video if you're getting what you need out of this regarding 16% of the MBLEx is ethics. Okay, I'll see you over there.
A client arrives late and becomes frustrated when you remind them that their session will still end at the scheduled time. They accuse you of discrimination because you refuse to extend their session. What should you do first? Now let's look at this question for just a second. It says, what should you do first? There's like a long, there's a few different steps that you should do in the long run, but they want you to acknowledge the first step replying to the client. So A, calmly explain your policy applies to all clients equally and offer to reschedule. B, defend yourself by explaining your own background and values. C, apologize and offer a free extra 15 minutes to avoid conflict. Or D, end the session immediately and report the client. So, yeah, if it can be tempting when you're in a room alone with a client that starts to become hostile toward you and tells you that you're discriminating against them, it really makes for an uncomfortable session. The rest of the session kind of sucks. But sometimes that happens where they're just not going to relax through the session. You do what you were paid to do, and you go ahead and finish at the time that your policy says that you're supposed to finish. So yeah, sometimes it sucks and you want to, not have that conflict. But I always leave the ball in my client's court when it comes to them leaving, unless they have dramatically imposed on my boundaries. So them just being a little bit upset and accusing you of discrimination is not a huge boundary violation. It's just you guys disagree, essentially. So, but you had a policy. So your policy applies to all of your clients, and that's why I would go with A, calmly explain your policy applies to all of your clients equally, and say, yeah, I'll reschedule you and give you the full amount of time, but you got to show up on time, right? I have clients that are waiting right after you, and you would not like that if you were kept waiting because the previous client was late. So yes, calmly explain your policy applies to all clients equally. And then ethical behavior includes treating all clients consistently and fairly. Maintaining professional policies while communicating calmly upholds both equality and boundaries. And then your client will know what to expect next time. If you're always a pushover, giving them everything that they demand, it ends up cascading into a worse and worse scenario where they will take advantage of you more and more, and your relationship will deteriorate. So it's better to just sort out whether or not you're a good match from the beginning and let them decide whether or not they're going to come back. Next question. During a session, a client starts talking about their marital problems and asks for your personal advice. What's the most appropriate response? I do get this often with clients that have become comfortable with me. So A, offer empathetic listening, but gently redirect the conversation back to their bodywork goals. B, share a similar story from your own life to show understanding. I'm sure we all have similar stories, but that's not the right place for it. C, give relationship advice since they trust you. Or D, end the session immediately. So yeah, the easygoing way to handle a situation like that is their stuff comes up when you have a client on the table and they're starting to unwind and relax. They're just like, oh, I've been so frustrated lately and this is making me really tense. Yeah, that sucks. I'm so sorry to hear that. And be empathetic about it. Don't be a jerk, but also be like, how does this feel? Or just take some big deep breaths. I understand it's really hard right now, but just take some big deep breaths and focus on your body right now. This is the time to get away from that. So the answer would be A, offer empathetic listening, but gently redirect the conversation. And then the explanation would be, it's fine to acknowledge a client's emotion, but the therapist should refocus the purpose of the session. Providing personal advice crosses into counseling, which is outside of the scope. Another question. A client begins flirting during sessions and hints at wanting to date you. You feel uncomfortable but want to handle it professionally. What should you do first? Now, if a client is persistent at wanting to date you, then you can just set your boundaries and that this is making me uncomfortable because I'm here working on you and you're trying to push outside of this therapeutic relationship. So that's a big picture, a longer term conversation to have. But while they are on the table and you're trying to professionally work on them, you would want to acknowledge the behavior. A, again, restate professional boundaries and redirect focus to the therapeutic work. So just I can't date my clients. This relationship has to stay professional. It's the law. I can't help it. Ooh. But also, you don't have to even be nice about it. You can just be, nice, but professional. You have to be professional about it, but you don't have to be like, I'm sorry about stuff like that, because it's just straight up, this relationship started professional, it has to end professional. So B, flirt back lightly to avoid awkwardness. C, end the session immediately without explanation, which we always explain why we're ending the sessions. If someone has crossed your boundary to the point where you need to end the session, then you would explain why professionally. And D, ignore it and hope the behavior stops, which never works. It never works to ignore it. And then regarding flirting back to avoid awkwardness, as a massage therapist professional, your clients know what the situation is when they start with you. And so there's no reason for you to feel awkward about having those professional boundaries. And you should assume that they are also adults and that they can handle being turned down for a date. That they are, if they're not able to handle being turned down for a date, awkwardness is going to happen, whatever, and let them decide to leave if they want to leave. Let them decide to not come back if they don't want to come back. There are lots more clients that are actually not going to try to flirt with you. So once again, A would be the answer. Acknowledge the behavior, restate professional boundaries, and redirect focus to the therapeutic work. Explanation. When boundaries are tested, respond calmly and assertively. Addressing the behavior directly but respectfully helps preserve safety, clarity, and the therapeutic purpose of the session. Another question. A client recovering from surgery asks you to remove their bandages and assess their incision. What's the best response? Oh, gosh. Well, if somebody has an incision in like their leg or something like that, we went over this in pathologies, then you just want to avoid that leg altogether. So there's that first thing. If they've got an incision on any part of the body, like the torso, you shouldn't be working on them at all while they heal. So that's the first thing I want to say. But if it's, in this case, if you get a question like that, what's the best response? Let's look at the choices. A, remove the bandages carefully and document what you observe. B, decline and explain that wound care is outside of your scope of practice. C, do a light massage around the incision area to help healing. Or D, call another therapist to assist. So I would choose B, because we're not going to be touching anybody's wounds just for so many reasons. Or somebody's bandages, right? We're not going to be touching it for so many reasons. We don't want to expose the wound to any kind of infection. We don't want to get any kind of bacteria or viruses on our bodies. And yeah, we don't do wound care, that we are massage therapists. It's a totally different thing if you're a nurse and you're wearing your nurse hat. So I would go with B, decline, and explain why. Wound assessment and bandage removal are medical procedures, not massage therapy tasks. The therapist must decline and recommend medical follow-up instead. Like, you got to go to the doctor for that. All right, another question. This is going to be the last one. You find yourself feeling irritated with a particular client because their communication style reminds you of a family member. What is the most ethical step to take? I mentioned this in the rest of the presentation, that sometimes you're like, oh wow, that person really gets on my nerves, and because it reminds you of something, and that happens, right? But we need to say, wow, that's happening with me, and adjust our behavior, adjust our mindset accordingly. Here are our choices. A, end the professional relationship immediately. If you're feeling your boundaries being violated and you don't feel like you're a good match, then it is good to have that conversation with your client. If you feel like the two of you are not a good match because of a true boundary violation. But just deciding, you're like, I'm in the middle of a massage and I'm just like, I'm done with you, and walking away, and that's not professional. So B, pretend nothing is wrong and continue as usual. Maybe my client would see that part, but internally I am like working on myself, right? My client might not ever find out why I might be feeling the way that I'm feeling. Okay. C, acknowledge your reaction privately, maintain professionalism, and seek peer or supervisory support if needed. I like that one. Private acknowledgement. This is what I'm doing right now. I need to be mindful about that. Maintain professionalism, which might seem like to your client that nothing is wrong. And then talk to somebody if you need to. And then D, tell the client about the similarities so that they understand. You know what? You remind me of my jerky uncle. Well, I would go with C. All right? And then the explanation would be that this is a form of counter-transference where you are projecting your beliefs or your feelings onto your client. The therapist's self-awareness and commitment to professional reflection helps maintain objectivity and protect the client's experience. All right, that's it for us today. Thank you so much for tuning in to this webinar all about ethics. It was a pretty nice, long, deep dive. Now, if this video was great, make sure and subscribe and make sure and like this video so other future massage therapists have access to it. And I will see you in the next video. Toodaloo.